name's Isabelle Jackson, and today we're going to talk about the human skeleton. I have my little skeleton here with me. There are 206 bones in the human skeleton. It can be divided into two separate parts. The first part is called the axial skeleton, and there are 80 bones in an axial skeleton. This is composed of the head, the spine, and the pelvis, some bones in the ear, and the hyoid bone. So we're going to start with our head. This can be divided into two separate parts. We have our cranium. So this is our frontal bone. We have our two temporal bones, two parietal bones, and then on the back of our skeleton, this is our occipital bone. It makes up the back of the head. Little note here is we have suture lines on the skull, and these do not completely form until we are about 12 or 13 years old. On a baby, if you've ever felt the soft spot right here, this front soft spot is the very last part to heal and to close up. And that closes when the baby's about 18 months. And this allows for movement of the skull as the baby passes through the mother's birth canal. That's why sometimes when you look at babies that have been born regularly out of the vagina, their head is smushed a little bit versus a C-section baby where their heads are nice and round. That's how you can kind of differentiate between those. But of course, everybody's pops back to a normal size and nice round shape. The next part we're going to talk about is the spinal column. We have three parts to that. We have the cervical spine, the thoracic, and the lumbar spine. So the C-spine has 7 vertebrae, and then the T-spine has 12, and the lumbar has 5. And we also have a sacrum and coccyx. The way that I remember the spine is breakfast at 7, lunch at 12, and dinner at 5. That's a little tip for remembering those. And next we have our pelvis. So on the male pelvis, you'll find that the pelvic bones are much more narrow versus a female. They're more flared out. This is for childbirth again. And then there's a little piece of cartilage in the front here, which is called the pubis symphysis. This piece of cartilage is way thicker in females. And when a female gets pregnant, this expands to allow birth for the baby to go through the birth canal. And then it takes about 6 years after the baby is born before that completely can go right back to normal size. So your hips are actually slightly bigger after giving birth to a baby than before. Facial bones. Okay, so we're going to go over the facial bones. Okay, so you might want to look at this picture here. We have the two maxilla, which is the upper jaw, the two zygomatic bones, which is on the cheek, two lacrimal bones, which is in the eye, two nasal bones, and then two inferior nasal conchae, two palatine bones, one voma, which is the nose, and the mandible. And that makes a total of 14. Also in the skull, I forgot a couple that are on the inside, on the base of the skull. One is our sphenoid bone, which is, if you look at it on a piece of paper, it looks like a bat shape, and as if the back legs are poking out like it's flying. So it's like this. And then the other one we have is the ethmoid bone, which is also in the floor of the cranium. If you could cut through here, and it would be in the middle at the base. There. One thing that's different on the top two cervical bones is the C1 and C2. C1 is called the atlas, and C2 is called the axis. And this C2 has a little piece on it called the dens, which pokes up, and the axis sits on top of that and rotates around it. And this allows us for movement of our skull back and forth. So everybody thinks the eye is made of one bone, but actually the orbits are made up from multiple bones. They have the frontal, they have the lacrimal in by the nose, the ethmoid down here, and then there's the sphenoid, which is in the back, the palatine down sort of below, to more towards the mouth, and the zygoma right here on the outside, and maxilla. So then we have our ribs. Pause it. Okay, so next we're going to talk about our appendicular skeleton. This is composed of our clavicles, which are 2 in the front. We have our 2 scapula in the back. These help form the shoulder joint, which holds the humerus. This is a ball and socket joint. The only other ball and socket joint in the body would be our hip bone. Then we have our arms. This is the humerus on the top. We have the radius, which goes to your thumb, and the ulna, which goes to the back. These kind of twist a little bit over each other. And then we have the hand. We'll go into that in detail in a minute. We have our hip bones, and then the leg. So this is our femur. The big weight-bearing bone is your tibia, and then your fibula is on the outside, and then we have the foot. Okay, so we will go and talk about the hand first of all. The hand is made up of called metacarpals. The best way to think about, help me remember that is I think about your car. You drive your car with your hands, so metacarpals, versus your toes, which are your metatarsals. So T for tarsals, T for toes, C for carpals, and driving your car. That's how I remember those. So all of the fingers are called phalanges. And then we have eight bones in the hand, which are called carpals. Now the mnemonic that I use for remembering these is some lovers try positions that they can't handle. So scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, and hamitate. And that's just how I would remember them for the hand. Okay, next we're going to go into our feet. And there's a few less bones in the feet. We also have our metatarsals in the bottom here, and then the tarsals are the bigger bones. We have the big bottom one is called the calcaneus. That's our heel. Above that is the talus, and then we have the navicular and cuboid, and then we have 3 cuneiforms, and they are the medial, intermediate, and lateral cuneiform. Okay, can you stop it? So we have 4 different types of bones by classification. We have our long bone. An example would be the femur or the humerus. We have flat bones, which would be the pelvis. We also have irregular bones, which would be anything that's a funny shape. So I guess the scapula, because it's kind of uneven, or any of the carpals or tarsals would be irregular. And then we also have short bones. So let's say our phalanges. those would be our 4 types of bone. We also have an unusual bone on our kneecap, which is called the patella, and this is actually a sesamoid bone. And there are sesamoid bones in other parts of the body. A lot of times people have them right here on their thumb, and then they can also have them on the ball of their foot, kind of by their big toe. But these are not counted when you count the bones of the body, the 206 bones in the body. We have a couple different curvatures in our body. There's 3 curvatures in our spine, for example. In the bottom, in the lower back, this is curving this way in towards the front of the body, so that's called lordosis. We have at the T-spine here where it curves out the opposite way, that's called kyphosis. And then occasionally people have another lateral curvature of the spine, which is called scoliosis, and this is where it goes from side to side. That's not normal. You don't want that in there. Okay, that's it on that. So those are all the bones of the body. Remember, there's 206 bones. We have the axial, and then we have the appendicular skeleton. I know there's a lot of different bones in there to remember. Hopefully I gave you a quick brief overview of all the bones and that you learned something today, and thanks for watching.